Septic shock is a result of the body responding to an infection called sepsis. It causes a lack of blood flow, which leads to hypoxic injury caused by low oxygen supply, eventually leading to organ failure. Septic shock is caused by bacterium, fungi, viruses, and parasites. It occurs because of inflammatory chemicals released by the body causing vasodilation, leading to fluid leakage into the tissue, and the enzymes present for inflammation damages the blood vessels in the process. The early signs of septic shock include persistent hypotension with systolic BP less than 90, warm and flushed skin, fever, tachycardia, and tachypnea. The late signs of septic shock include changes in the level of consciousness, continued hypotension, cold and clammy skin, peripheral cyanosis, tachycardia, tachypnea, oliguria, which is the low output of urine, and coma. There are various risk factors included with septic shock. To make it easy to remember, we've used a mnemonic using the term sepsis. S is for suppressed immune system, E is for extreme age, including infants and elderly, P is for patients who've had an organ transplant, S is for surgical procedures, I is for indwelling devices, and S is for sicknesses that are chronic. A patient can be diagnosed with septic shock by checking if they are hypotensive, conducting a blood test to look for the presence of bacteria, measuring platelet count, electrolyte imbalance, and elevated white blood cell count. You can also look for low oxygen saturation, mean arterial pressure, which tells you whether the vital organs are receiving enough oxygen, the central venous pressure, which measures the pressure of superior vena cava, and high serum lactate levels, and urine output. Treatments include eliminating the cause, which means using broad-spectrum antibiotics until the blood culture results come back, increasing blood pressure in order to restore the perfusion, oxygen therapy via mask or nasal prongs, protein-activated C, which is given for anti-inflammatory effects, nutrition, controlling blood sugar using insulin, and dialysis if kidneys are failing. Complications of septic shock include amputation and cognitive impairments due to the lack of oxygen, decreased quality of life, organ failure, and death as a result of uncontrolled inflammation and low blood pressure. In case of septic shock, start with broad-spectrum antibiotics, provide the patient with nutrition, give protein-activated C to combat inflammation, use titrate vasopressors to cause vasodilation and increase systemic vascular resistance, give inotropics as a method to increase force of heart contractions, use crystalloids or colloid solutions as initial treatment to bring blood pressure back to normal, use steroids at a low dose to decrease inflammation, monitor hemodynamics to assess tissue perfusion, provide oxygenation, conduct blood cultures, and keep blood glucose levels less than 180 milligrams per deciliter.